There is a surge in the coronavirus cases among the incarcerated people in the Arizona Department of Corrections. Cronkite News reporter Katelyn Keenehan explored the reason behind the spread.
There are more than 49,000 coronavirus cases among incarcerated people in the United States, and the Arizona Department of Corrections, Rehabilitation and Reentry has reported 421 of them. The ADCRR holds more than 40,000 inmates, and the number of reported positive COVID-19 cases is nowhere near the full picture.
There's a lot of fear, there's a lot of anxiety.
North's husband is an inmate at Kingman. He's 78 years old, vulnerable to the virus, and completely unable to practice social distancing.
They're passing just that close, shoulder to shoulder, breathing on each other. That's how you go to your chow, right? That's how you go to get your pills, your medications.
The same thing was reported from other facilities.
I got neighbors 3 feet from me on each side. We all share the same bathroom, and there's no way for us to do it in there.
Wagner was released from the Yuma Cibola unit on June 8th. Yuma has been one of the worst complexes in terms of incubating COVID-19. It is well over 4,700 inmates, and the ADCRR tested 519 for the virus. Of those, 415 tested negative, and 100 tested positive, almost 1 in 5.
People that had tested positive out of every single dorm on the yard. So therefore, the whole dorm had been exposed.
I reached out to the Arizona Department of Corrections about this and received a standard reply saying the ADCRR continues to separate any inmates who exhibit flu-like symptoms from the general population for monitoring and appropriate follow-up care. But that does not seem to be the case behind closed doors. When inmates report symptoms, they are being turned away with no test.
All medical told them was you're dehydrated, drink some water, go back to the dorm.
There is nobody in the runs that my husband is near to that has been able to get a test. Not a single one.
The ADCRR also highlighted the other precautionary measures they were taking to protect inmates from the virus, such as suspending inmate visitation, halting inmate transfers to avoid cross-contamination, and providing small bars of soap upon request. But one critical component was missing from this list.
We'd ask the warden, why aren't we getting masks? And the warden would tell us to address medical. We address medical, and medical would tell us to address administration. And we could never get a straight answer.
Unlike Yuma, Kingman recently started providing 3 masks a week per inmate after seeing how desperately people desired them.
They wanted to reduce how much they had become a commodity. Because people with no money were trading them.
Masks were also not mandatory for any staff until June 12th, when Director David Shin released this employee notice saying this method has proven to be very effective in preventing the transmission of the virus. Meanwhile, fear continues to escalate for the inmates inside.
They're scared. They're scared that their year sins or their 2-year sins is going to turn into life sins.
Governor Doug Ducey announced Monday that inmates will start to be provided masks by the end of the week.
We have confirmation that all inmates, all correctional officers, and anyone released from state prison will leave with several masks.
Katelyn Keenehan, Cronkite News.
This story is made possible through a partnership between the Walter Cronkite School of Journalism and the Center for the Study of Religion and Conflict at Arizona State University, with the support of the Henry Luce Foundation.